Hi, I'm Dr. Prashant Joshi, and today I'll be talking about adenomyosis and how it affects your fertility. So, what is adenomyosis? So, this is a very common condition which can happen when your inner lining, that is the endometrial lining of the uterus, it starts growing inside the myometrium, that is the muscle layer of the uterus. So, think of it like this: the lining that should shed during your periods gets trapped inside the muscles. So every time it bleeds, it makes the uterus bulky, tender, and inflamed. So the common symptoms, what are the common symptoms of adenomyosis? So severe pain during your periods, that is called as dysmenorrhea. You can have heavy bleeding as well with clots passing during your periods. Sometimes it's just heaviness and pressure in your pelvis. Sometimes it's pain during intercourse. And sometimes there are no symptoms at all. So they are totally asymptomatic and you will not know that you have adenomyosis. So the next question is, how does it affect your fertility? So there are several ways adenomyosis can affect your fertility. First is because the uterine muscle becomes inflamed and thickened, it can disturb your sperm transport because the cavity is enlarged. Also, uterine contractions from these muscles become abnormal, affecting your embryo implantation. The receptivity may reduce, making your implantation difficult. And also, if you have conceived, because of these abnormal contractions and inflammation, you can have early miscarriages. So, in IVF patients, we often see slightly lower implantation rates in adenomyosis, especially if it's untreated and transfer is just done like that. The important point is to diagnose, not to miss it in an ultrasound. The best tool is still the ultrasound. An ultrasound can easily pick up. Some cases we will ask for an MRI also, which can detect it in a better way. So we look for a bulky uterus, asymmetrical walls. One wall is thicker than the other. There can be myometrial cysts. There can be shadowing, what we call as Venetian blind shadowing on a scan. The next question you might ask is, can I get pregnant with adenomyosis? Yes, yes, yes. Many women with adenomyosis conceive even naturally, or sometimes they will require IVF. But the right management does matter. So, what are your treatment options? If you know that you have adenomyosis, what are your treatment options? The treatment option depends on your age and your fertility goals. Usually, we give a short course of hormonal suppression before an IVF embryo transfer. It could be a leupride injection, that is GnRH, agonist therapy, 2 to 3 months we will give you, or we can give you elagolix, that is an oral antagonist. We'll do some changes in your transfer protocol and very good progesterone support after the transfer because you can have more contractions. Individualizing and planning is more important in case of adenomyosis because we need to control any inflammation which is there before you attempt your pregnancy. So if you have painful periods and infertility or even endometriosis, don't ignore it because adenomyosis is common, underdiagnosed, and it's a very treatable condition. The right protocol can significantly improve your chances. So save this video and follow me for more such fertility facts. Dr. Prashant Joshi signing.